My name is Kieran Ling. It's Unit 5, Injury in Sport.
Right, so first off, P1, you've got to describe 4 different types of injuries associated with sports performance. So you can tell me about your first type of injury.
First type of injuries are soft tissue injuries. Soft tissue injuries refers to tendons, ligaments and muscles throughout your body. This is usually due to stress placed on a joint or overuse or can be caused by a single blow. There are 6 different types of soft tissue injuries: sprain, strains, bruising, grazes, blisters and cuts.
Can you tell me about one of them? So pick one and talk to me about what it is.
Bruising is where you're bleeding under your skin. It just shows up underneath, but you haven't actually got an open wound.
Alright, good. So then your second type?
Serious injuries. Serious injuries are such as concussion, back and spinal cord injuries. These are very serious injuries. These could affect you for the rest of your life. As soon as you get a serious injury, you should get treated straight away.
So can you give us an example of one?
Concussion is a blow to the head. This can cause temporary consciousness and stops the brain to function properly for a while. People who have a blow to the head sometimes confused. Sometimes you will feel confused.
Good. So then third type of injury?
Fractures. A fracture is the same as a break. As soon as one of these occur, you should get treated straight away, as the bone could not heal properly. There are 2 types of fractures: open fracture and closed fracture. These are caused by high energy injuries. An open fracture, a bone that pierces the skin, and a closed fracture is a break that does not pierce the skin.
Good, well done. So then final type?
Overuse. Overuse, for example, in tennis, you are repeatedly using the same joint over and over. You could strain your joints in your elbow and make them weaker. Tendinitis, inflammation or irritation of a tendon or tendon, is the fibre that attaches your muscle to your bone in your Achilles. Has a slow blood supply, so this would take a while to cure, at least 5 months. Also, if you are jogging a lot, you could also get shin splint. This is what comes in the front of your shin, what gives you a lot of uncomforting pain.
Good. So now for P2, can you describe to me 2 types of illnesses?
Hypoglycemia.
Hypoglycemia, yeah?
Yeah, this is a low level of sugar in your blood. This is when glucose levels are low by not eating enough or doing too much physical activity. A person with low blood sugar could feel the following: nervous sweating, intense hunger, tremblors, weakness, palpitations, or trouble in speaking. Glucose is vital for the brain to function properly. It is very important in sport because sugar gives you energy. If you do not have it, you would feel very weak. You could overcome this by eating pasta before doing physical activity because it gives out energy in a
slow way, yeah. Good. So then just your final illness?
Asthma. When your airways become inflamed and sensitive airways and affects your breathing. If you have asthma, you never know when it's going to hit you. It can more likely occur when taking part in physical exercise or changing the temperature, humidity. Symptoms include tightening of the chest, coughing, wheezing, feelings of fatigue, I don't know how to say that, and shortness of breath. Asthma attack normally lasts around 15 to 20 minutes. Afterwards, those symptoms will still last 5 to 10 minutes. These treatments what prevent red and brown reduced inflammation. Blue colours make airways bigger, are both good for short-term relievers.